Hi, how you doing? Dr. Mabanta again. I just wanted to look at the area of chiropractic where people are experiencing pain. Sometimes pain can fluctuate during the course of care. It'll go and come at different rates. The thing to understand about pain is that it's a sign that there's a problem in your body and that there is some damage that has occurred. So a lot of times people will undergo care and they'll say, well, I'm still getting the pain. I'm still having the symptoms. And I don't see like I'm getting any better from the treatment. And the thing to understand there is that sometimes you could be improving the condition of the body, but the pain is still persistent for a reason. The reason why is because your body still has to repair itself. So if you ever, had a splinter, for example, and you pulled the splinter out, remove the cause of the splinter or the pain that you're getting from that injury, but you still have pain and soreness. That's because that tissue still has to regenerate. Those cells have to recover, rebuild, and build new tissue in that area. Same type of thing happens with chiropractic care. When you correct the spine, you can restore the function, but the body still has to repair itself. And it's an important concept in health in general, is that every type of process requires time. For example, when you fracture a bone, it takes 6 to 8 weeks for that bone to heal. When a woman has a baby, it takes 9 months to grow and to have that gestation period to develop a healthy fetus and infant. So healing and regeneration of tissues also has a time period. And it has to go through that time period in order for the symptoms to stop and more importantly for the area to restore itself to a higher level of function. And ultimately the pain will go away. Another thing that can happen is sometimes the pain can even feel a little bit worse once you undergo treatment. So when you adjust an area that's already injured and sore and inflamed, and you start to change that area, it can flare things out. Think about the splinter again. If I go into that area where that splinter is digging into my body and I start moving it around and trying to pull it out, it creates an irritation and it hurts more. You're resisting the movement of that splinter because it's in a wound that's sore and inflamed and irritated. So if you're working around the spine and you have an area that's been damaged and degenerated as a result of misalignment for an extended period of time, when you start to adjust and align and reposition and heal that area, the symptoms can actually flare up. So symptoms can get worse and they can get better. Understand there's a time period that's necessary for regeneration and healing, and you have to go through that time period that your body has to heal itself. So a little bit about pain and symptoms. Stick with the care. Allow the body to go through its natural process. Thanks. I'll talk to you later.